The figure, specifically figure number two, it demonstrates an unusual treatment approach in mandibular molars, where a root canal treatment was performed in the mesial root canals, while the distal root canal was managed by full pulpotomy, or what we call vital pulp therapy. So, as we can see, this is not a traditional management for a tooth that is diagnosed with irreversible papyrus and apicoperiodontitis. Viewing this specific picture or this figure, it got a lot of questions in regard of our practice in endodontics. Starting with what is this treatment concept? What is the biological rationale behind combining vital pulp therapy and non-surgical root canal treatment in the same tooth as a treatment option? So this article in 2021, the Journal of Endodontics, they published a prospective study where an Indian group aimed to assess the outcome of combination of non-surgical root canal treatment and vital pulp therapy and permanent mandibular molars with symptomatic reversible papyrus and apicoperiodontitis. Justifying their approach or why they conducted this study by relying on case report that was treated an immature permanent molar having pulp necrosis with chronic apical abscesses with a combination of revascularization and vital pulp therapy. And from that specific case report at 18-month follow-up, the tooth showed regeneration of a new vital tissues, prevention of radicular vital pulp, and continuous root development. In their methodology from this specific study, 60 patients were recruited into two groups following their inclusion and exclusion criteria. All of the recruited cases were diagnosed as irreversible papyrus with a preapical index score as 3 or more. The groups or the cases were randomized into either a group that received non-surgical root canal treatment or a group that received combination treatment. And their findings from this specific study revealed that assessing the outcome, which is the outcome measure that they wanted to assess, the post-operative pain, clinical signs and symptoms, and also changes in the preapical score. In 12 months intervals, there were 100% recall rate, and there was no statistical significant difference in between the groups when it comes to the healed and non-healed cases, giving that the non-surgical group had 90% success at 12 months and 93% to the combination group. And also there was no significantly statistical significant difference between the groups when it comes to pain score at 24 hours and 72 hours intervals. So going through this study challenges the traditional concept of treating apicoperiodontitis or treating symptomatic irreversible papyrus, that all canals in the teeth require the same treatment. The model shows significant strength. It shows that it is a prospective model, there was randomization, 100% recall rates, standardization of the treatment protocol. However, the evidence remained primary or preliminary because of the sample size is small, the follow-up was short, up to 1 year. No long-term data are available. Therefore, the technique should not currently be considered as a permanent or as a treatment option. However, it should be considered as an experimental or emerging treatment strategy rather than a standardized alternative to conventional root canal treatment.